19 after 9 o'clock. This is News and Views on Salam Media, and we're now going to be talking with someone from the South African Medical Association, none other than the chairperson himself, Dr. Mvuyisi Mzukwa. A very good morning to you. Welcome to the program, and I do hope I'm saying your name properly, correctly.
Good morning to you and to your viewers. And yeah, the name is correct and the surname is pronounced correctly. Thank you for that.
Oh, yippee. Nice to have you on the show. But of course, what we're going to be talking about is really sad because we understand that despite South Africa's health skills shortage, we know the state of play at our state hospitals, long queues, not enough personnel, medical personnel. Many a day, a lot of patients have to go home who were unattended to simply because the queues were way too long. And that's really a very sad indictment of us as South Africans. But despite, and in spite of that issue, we are hearing that there are almost 800 medical doctors, newly qualified, obviously, that are unemployed. Why do we find ourselves in a situation like this?
Thank you so much for inviting me. I think, as the South African Medical Association, we are deeply concerned about the fact that we've got so many unemployed doctors, who are fully qualified. And, we find ourselves with those people who are not employed. But the thing is, there's a dire shortage in the public sector. As the nation were heading towards the NHI, we thought that government would be populating all those vacancies so that we are ready to implement NHI. But according to what we see a government that has poor planning, and a government that does not communicate, but also a fragmented state of affairs. Because if you look at the provinces, they keep doing their own thing. There's no coordination. Some of them have sent students to Russia, other countries, using provincial monies. But, those students, at times, they were dumped there without any proper funding for them. So when they come back, obviously, no one takes care of them, and there's no coordination with placement of those doctors in the public sector. So what it means, ultimately, we're training for other countries.
That's a very sad indictment of our Department of Health and the state of affairs here in South Africa. We have heard those stories about the foreign trained doctors. They've been sent by their local municipalities, whether rightly or wrongly, but they have been sent, but then they were left destitute in those situations. I'm not necessarily talking about those students. I'm talking about home trained medical doctors who can't find placement. But yes, we do need to add a voice to those that have been trained in foreign countries. And they probably went to foreign countries because they couldn't get placement at universities back home. They had no option but to go to foreign countries to go and study. And then, of course, like with the Russian students, they were funded. They got bursaries because they couldn't afford, parents and the community couldn't afford their studies. So that's why we find these different scenarios. And whichever scenario, as a medical doctor, you find yourself in, you are still not employed. And we can't have that in our country. And then you also mentioned NHI. I mean, do you really think, and it might be an unfair question that I'm putting to you, but do you honestly believe that NHI is workable in the current situation in our country? I shudder to think what's going to happen when NHI is introduced. So let's go to the first statement that I've made, and that's not only foreign trained doctors, it's also locally trained doctors who can't seem to find placements in our public health sector.
You are correct. When I included those foreign trained students and stuff like that, I was mentioning, the issue. I was expanding on the issue that I raised of poor planning by the National Department of Health, including the provinces. But yes, you are correct. The doctors we're talking about now are those that have already completed their internship. They've done their community service. They are independent doctors. In other words, they can work without any supervision. So those are doctors that we're talking about now who are unemployed. And some of them are bursary holders, by the way. So you would expect that the government would not necessarily terminate or unilaterally change that contract without having negotiated with those doctors. But secondly, the other thing is, it's not government money, it's taxpayers' money. It
Ah,
is communities. It is communities who have trained those doctors to come back and serve them. So when you have a government releasing those doctors, they are not releasing them from the contract, but they are releasing them from communities without the communities, agreeing to that. So it is very crucial that we highlight that our government is the one that are driving doctors outside of the country, outside of the public sector by poor planning. That is why we continue to have those challenges in the public sector. The question that the South African Medical Association is asking is, why aren't we having a bailout like we do with your useless SAA and other state
ha.
entities?
Absolutely, absolutely. Monies have been squandered. It is unimaginable the amount of monies that has been squandered, and like you rightly say, all our taxpayers' money. And these are crucial services. This is keeping our citizens healthy. We need these 800 doctors to come back into the loop. They need to be served. They need to be working. They need to be healing people, which is their job, and we need to have healthier citizens in our country. The point also is a lot of these doctors don't have the resources to go overseas to follow careers overseas. They want to serve South Africa. Government has to come up with a feasible plan. One of those could be take these doctors on board in clinics and state hospitals. And Sama, here is where you can come in and say, give them a stipend for perhaps the first year, let them become more experienced. Once they've passed the first year of experience, you're comfortable that they are experienced enough, then create opportunities for them, try and absorb them into the system. But what the government is doing is not right. We have way too many people who need medical services, and on the other hand, we have medical doctors who can't find jobs.
You're correct. Let me stress the fact that these are doctors, by the way, because when they did their internship, they are furthering their training there, practical training. And when they then do community service, they then strengthen those skills. So we're talking about people who are really skilled already, who are already prepared, to work, and give services, proper services, quality services to communities. But the thing is, even the working conditions, in those that are in the state, working for the state, they're suffering from burnout because of the low numbers. You'll understand that there are long queues. There's a backlog in terms of operations because there's shortages. And on top of that, you've got these unworkable working conditions where you find that there's hospitals are dilapidated, there's broken equipment, and also there's security threats, to our healthcare workers. So those are the issues that are pushing out even the experienced one. You will understand that most of these experienced specialists who are training other specialists to come on board have most of them are leaving now, leaving the state because of these conditions in the state that is not being attended to. And they are going to the private sector. Some of them are going to other countries like New Zealand and stuff like that. And people say to us, but why are these doctors running away from the NHI? Because these other countries are running NHI. But that's not the NHI that we see in other countries. We see what we call universal health coverage as envisaged by the World Health Organization. And their healthcare systems are well managed compared to ours. So people are going to run from a system that is not well managed, obviously going to a well managed system because they want to improve their lives and continue their careers. So these are issues that when we put out to government, I don't think they really understand what is going to happen if we continue to lose these practitioners, including the ones that are unemployed now, because they can't remain there in limbo without getting any job.
So let's try and understand how do we move forward on this very critical issue in the country. We know that US SAMA do have medical health professionals' best interests at heart. You also realize that if we do not have enough personnel on board, our citizens are not going to be getting the health services they deserve, which they're being taxed for in any event, or, in some instances, they do have medical aid. Thank God for that. That can also assist them in getting the
Mm.
services they need. How do we move forward on this?
Well, this is important because recently, on the 19th of this month, there was a webinar where we called all the unemployed doctors, to work together to come up with solutions. We even invited the Department of Health, Dr. Percy Mahlati, to come and have this discussion with us. And there's many issues that we have raised there. That we think that we must resolve this problem immediately. But what we can do is ask Treasury to bail out the Department of Health, because if you look at what has been happening from Treasury, there's been a reduction in the budget of healthcare, about 1% each year. So obviously, if you include the mismanagement of funds, I mean, people have been buying skinny jeans in the hospitals. I don't know for what.
Tembisa, yes,
Yeah,
we're aware of that story.
exactly. So if you've got mismanagement and you've got poor budgeting as well, these are the things that we think there must be a bailout. Obviously, there must be issues and measures in place, to make sure that there's no mismanagement of funds. But let those funds be there. Treasury is there. They've been bailing out other state entities. This is a very critical one. The Department of Health must be bailed out by this government.
Are you hopeful, knowing that we had that horrible scandal with Tembisa Hospital and many other such institutions? We also know that the casualty was very sadly Babita Deokaran, because she obviously was the whistleblower in that situation. Has the situation gotten better in regards these hospitals and the fraud that goes on in the hospitals? Has government tightened up at all?
Well, they have not tightened anything. In fact, the situation is getting worse because if you look at the report, by the health ombuds, Professor William Mahoba, the former health ombud, I mean, it spells it out clearly that we've got a serious problem of leadership and governance. We've been having acting CEOs and acting that and acting that. And that platform has always been used to employ, cadres from whatever political party. So this is critical for us to say, people don't destroy our healthcare system by deploying incompetent people in those positions. All we need now is somebody who's going to lead us, as the Minister of Health and the Deputy Minister of Health, to say these are the issues we are, attending to the matters of leadership and governance. but also we are going to monitor how funds are being used in the system, because efficiency is necessary in the system. We can't continue to have scandals like those, but also how do we protect those that are whistleblowing, to harms like we are seeing. Those are
Okay.
important questions that need to be brought in place.
Okay, your line is a bit unstable. We're going to have to leave it there. And of course, I guess the key takeaway message we want to leave our listeners with this morning is the state of affairs regarding the 800 unemployed doctors. Something needs to be done, and something needs to be done quickly to get these people into the system, to give them meaningful employment, and for them to service the state institutions, the medical institutions. Dr. Mvuyisi Mzukwa, thank you indeed for being with us on the show this morning. You are the chairperson of SAMA. Keep up the great work. We do
Thank
hope
you.
that you guys can put enough pressure on government to start changing the status quo. God bless.
Thank you. God bless you too. Thank you.
9:35 exactly, news and views on Salam Media. We're now standing by to talk with Abdul Alim Khamsa, Islamic Relief South Africa, Head of Fund Development, and we're going to get an update regarding all of their projects. So please stay with us.